Welcome to Connective Care Education. Today we're going to look at Unit 001, Principles and Values of Health and Social Care Adults. Unit 001, Outcome 7, Understanding the Importance of Effective Communication in Health and Social Care. Let's look at the importance of effective communication for well-being. The importance of effective communication for the well-being of individuals. Introduction. Health and social care workers help individuals understand the support available to meet their needs. They do this by ensuring that the information the individual needs is accessible. Exchanging information is important in order to develop an understanding of the needs of an individual, to support individuals requiring the care and improve the quality of service provision. Why is clear and effective communication important? Health and social care workers will form many different relationships in their job role. Some will be formal and others informal. Two-way communication is needed for these relationships and to establish the boundaries of the relationship. This will also help to ensure that everyone involved understands the purpose of the relationship and what they are aiming to achieve. The relationships between workers and individuals accessing services and between colleagues have an impact on the ability to provide effective care and support. Respect for each other can be developed through the use of good communication. Getting to know individuals by talking and listening to them will enable carers to develop an understanding and awareness which will lead to stronger relationships in the long term. Positive relationships are developed between workers and individuals when they communicate effectively and trust is established. In order to maintain effective support and achieve success, each individual involved in a relationship should be clear about what their responsibilities are and what the other individual's expectations are. Please pause the video here and complete Worksheet Learning Outcome 7, Worksheet 1. Why is good communication important? Key features of effective communication. Features of effective communication. Verbal communication is an important method of communication between carers and individuals. Through regular conversations, ideas can be exchanged and decisions can be made through a process of speaking and listening. Communication is therefore a two-way process. Ideas can be exchanged and decisions made there and then. If there is any confusion about what has been said, this can be clarified at the time so that everyone knows and understands exactly what has happened or is going to happen in the future. Individuals will be able to find out about the care or support they need or will be needing in the future. Instructions can be given to other health and social care workers so that they know what their duties are. In addition, activities can be carried out and problems solved, using an appropriate method of communication for the individual. Co-production relies upon effective communication within teams. Please pause the video here and complete Worksheet Learning Outcome 7, Worksheet 2, Features of Effective Communication. Skills that are needed to communicate effectively. How to communicate effectively. Within health and social care practice, we sometimes need to adapt our method of communication to meet the needs of the individual we care for. We need to ensure we speak clearly and prevent using jargon or terminology that may be difficult for the individual to understand. Active listening helps to maximise the communication interaction. It's important to show that workers are listening to the individual and that they have heard and understood what has been said. Using reassuring smiles and eye contact ensures that individuals understand that workers are interested in what is being said. Carers should use open body language and using gestures can also be helpful. Showing interest in what is being said encourages individuals to communicate more and can improve the level of detail they are prepared to give. Communication should not be rushed, as this might make an individual feel they are not important or that there is little respect for them. Please pause the video here and complete Worksheet Learning Outcome 7, Worksheet 3, How to Communicate Effectively. How to find out an individual's communication and language needs, wishes and preferences. Communication and language needs, wishes and preferences. Only about 10% of our communication is actually spoken, and through this two-way process of communication, health and social care workers are able to work with individuals and their families in order to ascertain what their needs are and what can be put in place to support them. It is important that during this process that the individual is allowed to speak freely and not overly questioned, as this can be overwhelming. Health and social care workers need to adapt their communication styles and techniques in order to ascertain information without putting the individuals under stress. When aiming to discover how an individual wishes to communicate, it is important to choose the right moment and the right place. If something needs to be discussed in private with an individual, it is vital to ensure that the choice of venue is private and that no one feels uncomfortable about the possibility of being overheard. Whilst friends and family can be helpful in this process, sometimes advocacy services are requested to help. Please pause the video here and complete worksheet Learning Outcome 7, Worksheet 4, How to find out an individual's communication and language needs, wishes and preferences. Potential barriers to effective communication and ways to address these. Barriers to good communication. Whichever way we choose to communicate, we must try to ensure that individuals who are receiving information can fully understand it and respond. But there may be times when a message is misinterpreted because barriers to the communication process have not been addressed. These barriers might include environmental, language, sensory loss, cultural. At times, communication barriers can be created when individuals misunderstand messages. For example, it can be easy to misinterpret a letter, telephone call, text message or email because these types of communication don't contain any body language to support and reinforce them. Being able to communicate face-to-face can provide visual clues of what information is being communicated. Environmental barriers. A health and social care environment can be noisy and distracting sometimes. It is important that health and social care workers know this and work to reduce any background noise to a minimum. It is also important that the worker ensures that the care environment is easily accessible and that the placement of the furniture encourages individuals to interact with each other. Arrangements should be made to have quieter spaces to promote effective communication when necessary. It is also important that the worker ensures that the environment is freely accessible. This will not only encourage conversation between individuals, but will also enable them to socialise. Language and cultural barriers. Language and cultural barriers that may hinder the communication process. If an individual dominates the communication process, communicating becomes a one-way process and responses from the individuals are hindered. If an individual talks too much about themselves, then the topic or focus of the communication changes. Swearing may be powerful at times, but it does not usually appeal to others. Using jargon. People often use words that belong exclusively to their area of expertise. Using patronising or condescending words, tone or behaviour will make individuals and their families feel angry and defensive. Using threats, implied or explicit, to persuade an individual into doing something they don't want to do. Or being callous, insensitive or unaware of own feelings and the feelings of others. Please pause the video here and complete worksheet Learning Outcome 7, Worksheet 5, Language and Cultural Barriers. Sensory impairment. Health and social care workers can support individuals who have visual impairment by making sure that their eyesight is tested regularly, that their spectacles are clean and worn properly, and that their possessions are kept in the same familiar place. An individual can also learn the correct way to guide and assist a partially sighted person while they are walking and find out what visual aids are available. Carers can support individuals with hearing impairment by making sure their hearing is tested regularly, that their hearing aid is clean and worn properly, and that the battery is not flat. A carer can also learn the correct way to replace a hearing aid battery. And lastly, overcoming barriers to communication. As a health and social care worker, it is important to make sure the physical environment is quiet, well lit, warm and comfortable. It is also important to know and understand how children and young people need to communicate and use a form of their own preferred communication. If appropriate, the individual may wish to use communication aids or human aids such as advocates, interpreters, translators and signers. Health and social care workers should speak clearly, use appropriate body language and actively listen to show that they are interested and are trying to understand what they are being told. It's also important that they can check the individual understands them correctly and that they can confirm that the message has been understood by asking the individual to relay back what is said. Workers need to become familiar with the needs of the individuals who have different cultural beliefs. They need to ensure that they are well informed of cultural practices and also how to support an individual to communicate in their preferred language, making every effort to provide resources and adapt communication methods to meet individual needs.